This meeting is being recorded.
All right, welcome everyone. Thank you for joining us today. I am Dr. Jeannie Hannon, the Director of Programs for Time to Heal Cancer Foundation, and we're excited that you're joining us today for Help is Here, Supportive Services for All Cancer Survivors. You may have also seen it as I Don't Know What I Don't Know, Resources and Referrals. So I am excited to introduce our speaker to you today. Dr. Villanueva is a board-certified physical medicine and rehabilitation physician and the co-medical director of Methodist Rehabilitation Center at Nebraska Methodist Hospital. His passion is to help people improve their physical, psychological, social, and vocational function after injury and illness, especially following cancer treatment. He is currently working in an acute inpatient rehabilitation unit and in an outpatient clinic. So please join me in welcoming Dr. Villanueva.
Good morning, everyone. Thank you so much for that introduction, Jeannie. I appreciate you and A Time to Heal welcoming me here this morning to talk about some really important topics, I think, for cancer survivors, their caregivers, family, and medical professionals. So before we get started, I just want to thank you all for attending this morning, whether that's from here locally in Omaha or the greater Nebraska area. I think I saw someone in the chat all the way from Fairbanks. Just a funny caveat, I have family that lives a lot of years up in Fairbanks and Anchorage, so welcome from the great frontier up there. Today we're going to be talking about a lot of different topics, so I'm not going to spend too much time saying hello, but of course, if you have any questions throughout the talk, Jeannie's going to be watching the group chat, and she'll let me know when there's questions, and we'll address them as they come. Obviously, we can also have some questions at the end, and I'll try to address them to the best of my ability, just knowing that I have a certain scope of practice, but if I can't answer your question, I'll be honest about that and try to direct you, if I can, to resources or professionals that can answer that. All right, I just want to go over some learning objectives, just so we'll all understand what we're covering today. So I think it's important to understand the conditions that can affect people who are diagnosed or undergoing treatment with cancer, outline, of course, the services that are available for addressing those conditions, and then understanding kind of my specialty and how we fit within the cancer treatment continuum. So physical medicine rehabilitation physicians like myself are also known as physiatrists, not to be confused with psychiatrists. We're all about optimizing patients' function and quality of life throughout the continuum of cancer care. And what our job is to diagnose and treat, manage different impairments and symptoms that result either from the cancer, the disease itself, or its subsequent treatments. As we know, unfortunately, sometimes the treatment can come with many side effects, either short term or long term. And so it's important to have those addressed as people are surviving and with cancer longer and longer. We also provide continuity of care and transitions from when patients are diagnosed with cancer, which we call kind of prehabilitation, to and through long-term survivorship with cancer. And it's actually pretty much the standard of care that physiatrist-led cancer rehabilitation should be integrated within cancer treatment and diagnosis of patients, as recognized by leading societies for cancer and as professionals. So what does the cancer rehabilitation team look like? Well, I came together and put this diagram for you all to kind of visualize it a little bit better. Of course, there's the physical medicine rehabilitation physician like myself, where trained and we do a 4-year residency before we go into practice. There's physical therapists who you may or may not have come across before, or I know we have some healthcare professionals joining us, so they may be licensed in one of these fields that we'll talk about. They kind of work on walking, getting up and out of a chair or to a toilet, using assistive devices if needed, like a walker or a cane to do that, helping with balance, strengthening, which sometimes can be impacted. We'll talk about that during cancer and its treatment, and sometimes helping with lymphedema as well, too, which can come from cancer, its treatment. Of course, there's the oncological providers, the surgical oncologists, medical oncologists, and radiation oncologists. as well as the palliative medicine team that we work closely with as well. Speech therapists, which is a bit of a misnomer, don't just work on improving speech, but work on swallowing and cognitive issues as well, and can be integral in helping patients after treatment or diagnosis of cancer. There's also neuropsychologists who help patients who deal with oftentimes mood changes throughout their treatment and diagnosis of cancer and can be very helpful throughout that process. Obviously, we want to acknowledge that cancer is not a fight alone, that oftentimes there's caregivers involved. And so we want to include them in our team when trying to help patients with cancer. Vocational therapy is all about helping patients try to return to work. Oftentimes, people are diagnosed when they're younger, which is kind of and we'll talk a little bit about the growing number of cancer, but there's actually increasing, and just saw this, and you might have caught this on the news the other day. There's an increasing number of young people under the age of 40, 45 being diagnosed with colon cancer. And so those people may be wanting to return to work while they're receiving treatment. So this vocational therapist can help with kind of assessing what skills and abilities they need to in order to return to work and how we can best assist them. Obviously, dietitian can be very important, especially for patients who are maybe having head and neck cancer and undergoing treatment for that, or other patients as well. We know chemotherapy, unfortunately, can cause changes to our ability to eat, can change our taste. And so having a dietitian on the team is really important in that respect. And an occupational therapist, I like to say they work on kind of things in the upper body. So strengthening of our arms, they help with things called activities of daily living, just like you would think about that. That's everything you do from when you get up in the morning to when you go to bed at night. So getting out of bed, getting dressed, showering, brushing your teeth, combing your hair, some of those things are impacted when we have cancer and undergo its treatment. Instrumental activities of daily living, those are things like driving, cooking, cleaning, laundry, managing our medications. These are all things also that can be impacted by cancer and its treatment. And they also can treat lymphedema. And we'll talk about the certified lymphedema therapists and their roles as we go through the presentation as well. As I was kind of alluding to, there's a growing number of cancer survivors, and this is attributed to a few different things. We're better at detecting cancer, which is great. We detect it earlier. We have more treatment options. We have better outcomes for people. There is, in that same line, better treatments. So people who are even being diagnosed later in life are surviving longer and living with cancer. And so as you can see in this graph, it's kind of split up over the years, the x-axis being, time from 1975 to 2040. We're predicted to see an increase in cancer survivors, up to 26 million people living with cancer in the United States by the year 2040. And I like to compare this to other patients that I commonly see either on the rehab unit at Methodist Hospital or just common patients I see in my clinic other than cancer survivors, to kind of put this in perspective. So we know that people at 2040, we should have approximately 26 million people living with cancer in the United States. Compare that to people living with stroke in the United States, which is a very common occurrence that we see on the rehab unit needing rehabilitation because of some functional impairments after a stroke. Somebody is weak on one side of their body, or they have numbness on one side of their body. About 7 million in comparison. Compare that to people who have suffered a traumatic brain injury, either from a motor vehicle accident or something like falling down a flight of stairs or just falling even a couple feet. There's about 5.3 million survivors of that in the United States. And then traumatic spinal cord injury survivors, a prevalence of about 300,000 in the United States. So comparing that to cancer survivors, we can see that there are some impairments in cancer survivors after their diagnosis or treatment that maybe we're not addressing. And so that's kind of where I'm saying that our role as cancer rehabilitation professionals can come into play and help cancer survivors. So here's a graph showing kind of the number of cancer survivors with limitations compared to those of stroke survivors with limitations. About little bit more than 4 million stroke survivors that have functional limitations. We'll compare that to cancer survivors, where it's almost double that, just about 8 million. So I fear that we're missing cancer survivors and providing care for them. And that's why I wanted to talk to you all about kind of services that can be offered for cancer survivors. So status check, as we talked about, cancer survivors are living longer, which is great. We're also diagnosing people earlier. Our treatments are better. And so there are actually more cancer survivors than those with other common rehab diagnoses, things that you would typically associate with needing to see a physical medicine and rehabilitation physician. And with this, there are many cancer survivors that have functional limitations. Either they're developing weakness, numbness, fatigue, endurance issues due to their cancer or treatment. And so cancer rehab is really needed. And we'll talk about some conditions that cancer rehabilitation physicians are particularly trained to address and how we might address them. Obviously, we don't address every condition, but we are very good at referring to appropriate providers when we think we need assistance. I included this quote from Austin Powers. What does it all mean? Well, it means that cancer rehabilitation is needed for these reasons. So what are some common conditions that I see in the clinic when patients come to me or referred either by their medical oncologist, surgical oncologist, radiation oncologist, or even family medicine doctors? So oftentimes I see people having issues with activity. They feel deconditioned after their treatment or diagnosis. That can be due to muscle weakness, some tightening of the muscles, or even muscle wasting. We'll talk about all this as we go through the presentation. Oftentimes, people unfortunately develop some numbness and tingling, and depending on where this is and what's involved, it could be due to the treatment or the chemotherapy they've received. Also, cancer or its treatment can lead to lymphedema, which is a swelling of extremity due to a blockage or a disruption in the lymphatic system. I often see people coming in with pain either from the cancer itself or its treatment. Radiation fibrosis is kind of a continuum of symptoms or conditions that can come after somebody's received radiation. It's a fibrosing or a tightening of the muscles that can lead to pain and impaired function. Obviously, depending on the location of the cancer or its treatment, you can have neurologic dysfunction. So issues with nerves, issues with muscles that can impair someone. We see a lot of people, unfortunately, after receiving treatment for breast cancer. This can be due to surgery with lumpectomy or mastectomy, but even due to chemotherapy and radiation, developing shoulder issues, restriction, and pain. Oftentimes, those with head and neck cancers can develop issues with opening their jaw or even feeding because of radiation or chemotherapy affecting the muscles there. A very, very common complaint of many cancer survivors. So if this is you, you should not feel alarmed, or you should not feel alone, is that there's fatigue after cancer treatment or its diagnosis. And we can talk about some things that we could potentially do to treat that. Cognitive deficits or chemo brain, as you might have heard, is also a common condition that I see a lot of patients for. Depending again on where the cancer is or its treatment, you can have gastrointestinal issues, so issues with bowel incontinence or constipation. Urologic dysfunction falls under the same issues, either with incontinence or urinary retention, where you can't urinate on your own. And then I think something that's not talked about as well, but should be, because it is a common condition, is issues with sexual health as well. And we'll talk about these. As it might not come as a surprise to you, there's a lot of unmet rehab needs among cancer survivors. In a large study that looked at about almost 10,000 cancer survivors after about 2 years of treatment, many people reported poor energy, concentration difficulty, sexual dysfunction, nerve issues, pain, lymphedema, incontinence. And unfortunately, a large majority of those who reported these symptoms did not receive care for them. So these are some gaps that we need to address as a cancer treatment team. Continuing along, people with metastatic breast cancer were found to have functional impairments, including one physical impairment that could benefit from rehab, but unfortunately, less than 30% were referred to a rehab provider or professional. Another large study looking at patients with a mixed diagnosis of many different cancers found that many needed physical therapy, and that even those who were in the hospital receiving treatment maybe had access to seeing a PM&R doctor there in the hospital, but very few received a consultation with a rehab physician. We know that physical function rather, impacts cancer mortality because oftentimes medical oncologists, surgical oncologists, radiation oncologists are using functional measures to predict mortality, and actually using them to choose kind of treatment options as well too. You might have heard of performance scales like the Eastern Conference scale, things like that, that sometimes people use to determine what treatments are available. Obviously, physical function comes to play a role in that scale. Activities of daily function also can predict recurrence, free survival, and overall survival in patients with cancer, and that treatment responses are often chosen based on how patients are doing physically as well. So it's really important that we do everything we can to improve physical function of patients with cancer. So let's talk about different resources for some of these common conditions that I see. Obviously, like I said, if you have questions throughout, please put those in the chat. Jeannie will let me know, and then we'll answer more questions at the end. So for those patients that I see come in with feeling decreased ability to tolerate exercise or feeling deconditioned, I'd like to obviously get them into working with a licensed occupational or physical therapist to work on endurance, strengthening, aerobic exercises, and providing a home exercise program. I tell patients when they come to see me that, it's going to be like going back to school. We want to get you in to see a therapist once, twice, maybe 3 times a week for 45 minutes to an hour at a time. But I also ask that you do your homework at home. And that's why I asked to give a home exercise program. And studies have actually shown that people who do exercises at home, in addition to working with a professional, do better long term. There's also exercise programs that are offered throughout here in Omaha and nationwide. Here in Omaha, through the Methodist Health System, there's Harper's Hope wellness classes that are offered, and I'll have a slide here in a minute with information on that. And then nationally, the YMCA through the Livestrong Foundation offers exercise programming called Livestrong, and we'll talk about that in just a moment. We talked about earlier about how vocational therapists can be a part of the cancer rehabilitation team, especially for patients who are looking to go back to work. The vocational therapists can evaluate kind of what functional impairments patients may have and what things can be done to help them get back to work. And actually in Nebraska, there's a really great vocational rehabilitation department that I refer patients to often. And then obviously a cancer rehabilitation physician is best suited to kind of direct referrals to these different areas and make sure patients are getting the care that they need. So we'll talk about the exercise programs in and of themselves. So the Harper's Hope wellness classes are offered at a Methodist hospital. They're offered for anyone with a cancer diagnosis, either past or present. No one gets turned away if you can't afford it for any financial reasons. You're required to get medical clearance, so that's why seeing a physician beforehand, like a cancer rehabilitation physician, is warranted. And it's what's great about these classes is they're taught by certified physical or occupational therapists. And you can see they do a variety of different types of exercises, everything from aerobics to different yoga, tai chi, aquatics, meditation. And so there's some information, you'll get the slides here, where you can contact someone to learn more about that if you're local to Omaha. Also local to Omaha, but nationally as well, there's these Livestrong classes at the YMCA. So it's a 12-week small group exercise program with the goal of increasing endurance, flexibility, balance, and overall quality of life. Free to any adult cancer survivor. And what's great about these is they meet in small groups, so you really get to kind of know the people that are working with you. And I think they provide some peer support as well too. meet twice a week for 1 hour and 15 minutes. And you also get a membership to the YMCA so that you can, again, kind of practice what's going on in the classes outside of the classes as well, too. We get a lot of questions about, well, going to therapy or working with dumbbells or getting on the treadmill is great and all, but what about alternative forms of exercise? So Pilates, yoga, Tai Chi, have these been shown to help patients with cancer? And they actually have. People who have undergone these alternative forms of exercise reported improved quality of life and fatigue. We need some more research on how these address maybe other conditions like sleeping issues, mood issues, and cognitive changes. But I think they can be very helpful, and I've had a lot of patients report that um, they feel like they help with creating a community for them, which is so important when you're going through cancer and its treatment. And I think there's also something to be said about the mindfulness dimension of a lot of these exercises that can really help relieve stress and anxiety in patients who have cancer.
We have a
Talking
couple
about,
questions, Dr. B.
okay, we'll try to answer them.
Okay. One was, are any of the classes taught online, or if they're not local to Omaha, do you know of any online exercise programs?
Great question. So the two classes I mentioned are both kind of in person. One's local to Omaha, that's the Harper's Hope Wellness classes, and then the Live Strong is nationally, but you have to go to YMCA typically for that. There are some videos that are available online, but there's nothing that's um, like a class that meets online live that I'm aware of. That would be great. If somebody finds that and can share that, that would be awesome. I would love to share that with patients. I think what really benefits people is having a class to go to because oftentimes people need some structure. I know I do. I really exercise better when I have people that are pushing me on and showing me how to do it correctly. And so that's why I really like these classes. And also, like I mentioned, from the peer support side of things, I think it's really good. I wish I had a class that I could think of off the top of my head that's live and online. There are some that are kind of more for like Peloton and things like that that offer classes that are live online. But I caution people doing those before talking to a physician just to make sure that you're cleared to that type of exercise and that level of exercise too.
Yeah. I will share a link with here. The American College of Sports Medicine, the exercise
Mm-hmm.
medicine, they have a moving through cancer
Right.
um program, and
Series, yeah.
on there's a survey that survivors can do, and then it matches them up with or tells them about programs in their area, or also I
Great.
think offers online, or it will refer them and say you need rehab or you need so I'll
Yeah,
find the link and put it in there if you're okay with
I
that.
love that.
And then another question was any words of wisdom how to approach a YMCA in our local community that does not offer Live Strong in order to have it added.
Great questions. I think one is to just show and demonstrate that there is a need. If there's a way to come across with, multiple people that are interested in that program, I think a lot of times, it's just not knowing that that's available and can be offered. Another way is to maybe try to contact the Live Strong Foundation and see if there's a way to get, people and resources out to that YMCA local to you. Could be hopeful and helpful in trying to find some kind of a program at your YMCA. I know there is at least one program in Omaha that one YMCA that does it in Omaha as well. Maybe they just need to spread to your community, and they're just not aware that there's a need there. So I think trying to demonstrate a need hopefully can help you achieve that goal.
Yeah, yeah. I wonder if it'd help to even contact Live Strong.
Yes, directly. I
Maybe
think that would
both
be
the Y
great.
and Live Strong and say, hey.
Yeah.
Um,
Hey, I think there's a need.
yeah. And then another question is, what if people need transportation? Do you have any recommendations on that?
That is always a barrier for some people. I will say that sometimes you can get transportation depending on your health system where you are to some of these, especially if you're going while you're receiving cancer treatment. Sometimes there will be a transportation available to go to those appointments, and that might be when some of these programs like Harper's Hope are happening. These programs sometimes can be online. It just depends on the provider who is doing these programs. So you can check in on that. I wish there were a better answer for that question. I think it also depends on what services you qualify for. If you're a veteran, sometimes you can qualify for transportation, depending on what type of insurance you have. Sometimes there are transportations available for patients on Medicaid through a PACE program, depending on the state or place you live in as well too. I've had patients also grab or use transportation like Uber or Lyft, ride share services to go to the exercises as well too. Or that's why it's great to try to find friends and family support to ask them for rides to activities like this.
Oh, buddy. Yeah, great. Thank you. And then also, everyone, I want to remind you to check out our Time to Heal website, atth.org, and then go to the resources tab. So we have a bunch of different resources on different topics, and maybe, that might also be another place to look. All
Yeah,
right,
great.
Dr. V, that's the only questions for right now. So I'll let you
Awesome. I love them so
carry
far.
on.
Thank you so much. Um, Going on to talk about kind of what are some of the causes for muscle weakness or muscle wasting that we see with patients with cancer. Could include a metastases, so that's where the cancer is maybe moved to the muscles. It could also be tumors that are in the muscles. Sometimes people have those. Unfortunately, some people can develop myopathies, which is kind of a muscle disorder that can sometimes be associated with people who have maybe received transplants and developed in graft versus host disease, where your body is not recognizing the transplant as part of you and so is attacking the transplant. Then that can lead to muscle issues. Unfortunately, some treatments are associated with these muscle disorders, such as immune checkpoint inhibitors. One that some people think of as commonly advertised is Keytruda. And then oftentimes, cancer survivors are on steroids, either for treatment or after treatment, for a variety of issues, a variety of things. And these, unfortunately, are associated with muscle issues as well. And that can affect up to 60% of cancer survivors who use steroids long term. One particular muscle weakness or wasting in cancer is called cachexia. It literally means bad appearance, and it's where a patient loses body weight due to their underlying illness. So I talk to patients about this, that it can either be due to cancer and or its treatment. Unfortunately, it's pretty prevalent in cancer, more so in the advanced stages of cancer, and can actually lead and be a part of cancer deaths due to this issue. And unfortunately, because of the muscle wasting leading to weakness, a lot of people develop impairments and disability due to this. So, how I approach this in my clinic is kind of threefold. It starts with optimizing nutrition. I take time to kind of find out how patients are eating, what they're eating, why are they not eating as much, and understanding, giving personalized recommendations on kind of what to eat. Obviously, referring them to a dietitian as well too. Addressing kind of the symptoms, like I said, that are maybe impacting their ability to eat, which can make it difficult to keep up on nutrition. So helping addressing these issues is equally important. And then we actually find that, of course, strengthening the muscles, trying to build the muscles up again, is a great way to prevent furthering of this cachexia condition. So coming up with an individualized exercise program for them, or referring them to structured therapy through physical or occupational therapy is important as well too. Further resources, as we talked about, physical and occupational therapy can be important for these patients that have muscle weakness or wasting. These exercise programs that we talked about, equally important, because again, it's all about rebuilding this muscle. Vocational rehabilitation, if patients are having issues getting back to work because of this weakness, talking with them, referring them to vocational rehabilitation is important. Some patients may benefit from different devices that may assist them in walking. And so sometimes this weakness can cause their foot to drop or their knee to have weakness. And so bracing with the help of an orthotist can be important as well too. And obviously having evaluation and treatment by a cancer rehabilitation physician is integral in addressing this condition in particular. Numbness and tingling, unfortunately, is a very common condition with cancer survivors. This can be due to chemotherapy neuropathy, but sometimes it's due to other issues. And so it's important to kind of see a provider and have yourself evaluated and make sure that it's not something else that's causing the numbness or tingling. It can also be due sometimes to metastasis. Unfortunately, I've seen this. Sometimes people come in with new weakness or new numbness in one area. We talked with their medical oncologists or radiation oncologists, got further imaging and found new or recurrence of their cancer. It can also be due just to swelling and impinging on the nerves, and that could be related to another issue, whether that's due to the heart, the kidneys, or lymphedema, which has to be addressed separately in a different way. How to address this? We'll see a cancer rehabilitation physician to be evaluated and make sure that we identify the cause or most likely cause of this. Management of bothersome pain that might be associated with this. We'll talk about in a little bit how to manage that pain. And then referral to therapy if there's issues with function. Oftentimes, people who can't feel their feet have issues with balance, coordination. And so working with a physical therapist on how to better walk and get around can be important. And at re-education of their neuromuscular, how the nerves communicate with the muscles and vice versa can be really helpful in this population. That's why we refer them to therapists, as well as providing sometimes a home safety assessment where the therapist might come into your home and make sure that there's not too many rugs around to trip on, or make sure that you're able to get in and out of your house or in and out of your bathroom safely. Those are things that a therapist can do for you. Fatigue is a very, very common condition, unfortunately, among cancer survivors, and probably something I see very commonly in my clinic. Unfortunately, it can develop kind of any time during that diagnosis, treatment phase, and even into survivorship and long-term after survivorship. It can be correlated with treatment. Depends on the treatment. Sometimes it's just correlated with the disease itself. There's different types of fatigue, and I try to explain to my patients kind of what I mean by central versus peripheral fatigue. If you have a fatigue where you're even just tired about thinking about doing something, like you get up in the morning and you're thinking about getting breakfast or preparing breakfast, and that causes you a wave of fatigue, it's more kind of central fatigue. Then peripheral fatigue is, my leg feels tired because I just walked a really long stretch. And so it's really important to differentiate these because that can be helpful in kind of determining what treatment options are best for the patient. One thing that I really try to teach patients about when they see me in clinic is that fatigue is part of a really terrible cycle. So fatigue leads to inactivity, right? You don't want to do anything because you're too tired. Well, that inactivity leads to further deconditioning, unfortunately. So you get weaker, your muscles get weaker, you get less likely to use your arms, and that can cause, or legs, and that can cause issues with your range of motion, and joints get stiffer. That can lead to more fatigue. And so what we need to do is introduce something to break this cycle. One thing we try to get people to do is try to be active more. And I know exercise, unfortunately, I think has a bad connotation in some respects, especially related to fatigue. When people come in with fatigue and we talk about exercise, I think people, and I understand why, go first to thinking about, oh, I need to get to the gym and run on a treadmill. I need to get to the gym and pump a bunch of weights. What I think of exercise is some form of physical activity. That is just you getting up and down from the couch. That is you walking around your living room 5 or 6 times, 3 times a day. That is the activity exercise I'm talking about. And that has been shown to kind of break this cycle, improve endurance, and give more energy to people so that they get out of this terrible cycle of fatigue and activity and deconditioning. There's many resources for fatigue, which is what I always tell my patients. One is obviously addressing any functional impairments that you might have due to the fatigue. So seeing a physical or occupational therapist can be great because they can give you tips on energy conservation and also help with strengthening, balance, assessing for maybe assistive devices that can help you with the fatigue. I had one patient who his goal was really just to be able to take a shower without feeling too tired that he didn't want to take a shower. And so we talked about devices that could help assist him, like a shower chair in the shower, so that he wouldn't have to stand for the entire time in a shower and so that he could take a shower without feeling too fatigued. And then, as we talked about before, having a therapist maybe come to the home and take a look and see if there's any devices or other adjustments that they could make to the home to make it easier for you to get around your home. So we talked about the importance of exercise, breaking that cycle of fatigue in patients with cancer. There has been a lot of research, and most of the research coming out, and I kind of looked at it again to update my slides for this presentation, talks about how much fatigue is a multifactorial issue, that there are many reasons why patients develop fatigue after cancer diagnosis or its treatment. And some of that is related to mood issues or anxiety, frustrations that come out during cancer and its treatment. And so a lot of studies have shown that meeting with a psychologist and undergoing cognitive behavioral therapy has improved patients' fatigue, whether that's soon after their cancer diagnosis or treatment, or even years down the road, that can be helpful. There's also been some research about medications, and many times I have patients that come and ask me, is there a pill that I can take? I say yes, but with an asterisk, because everybody is individualized, right? There's not a recommendation I can say, take this pill for everybody with cancer related fatigue and it will make you better. Because any medication that I talk with patients about has the potential to have side effects. And so there are some medications that have been investigated that can help with cancer fatigue, but it's all individualized to the patient. And so that's why it's best to be evaluated by somebody that has experience with cancer related fatigue and these medications to find out if there's a medication that's right for you. Continuing on, swelling, as we talked about a little bit before, can be a very common occurrence, especially in patients that have undergone surgery where there's maybe cutting into the skin that can disrupt the lymphatic system and cause this lymphedema, where basically it's a deposition of materials that aren't cleared out by the lymphatic system. But it's also important, and that usually affects one extremity. So, for example, I see a lot of cancer survivors with breast cancer who've undergone mastectomy, and so because of that, maybe had sentinel lymph node biopsy, and so because of that, have developed kind of swelling in one arm. That may be kind of more cut and dry lymphedema, but I've also had patients come in and had swelling. We've done an investigation, and the swelling has not really looked like lymphedema, but we've actually found it to be an issue with their heart or due to a blood clot, which is very common, unfortunately, with patients who are undergoing cancer or cancer treatment. And so it's very important to be evaluated by a physician or provider when you do have swelling and you're undergoing cancer or cancer treatment, as it may be due to a variety of different issues. It may even be due to your treatment that you're receiving. It can affect not just people with breast cancer, but other people who have had surgery, just something that's disrupted the lymphatic system. So I see after pelvic or abdominal surgery radiation, legs can be affected. Also, those with head and neck cancers can also have, unfortunately, head or neck lymphedema, and that can be things that we see in our office as well. How do we treat these patients in this condition? So there's certified lymphedema therapists who go through this extensive training on kind of identifying and treating lymphedema for a variety of different reasons, but most commonly for cancer. And they're usually a physical or occupational therapist with this additional training. And what we refer cancer survivors to them to do is this complete decongestive therapy, or CDT, where they do manual lymphatic drainage. So that means using your hands to actually push the fluid to areas where it can be absorbed or are taken out of the arm or leg that's swollen, using then compressive wraps or garments that are sized to the patient. Sometimes that includes, you might have heard of pumps, where they're active pumps that provide pneumatic compression to that area to help get the swelling down, and also provide exercises further for reduction of the swelling in that area. It's also important that we educate these cancer survivors on skincare and monitoring, because people with lymphedema, unfortunately, are higher risk of developing skin infection due to issues with the skin from the swelling. So from my perspective, when I see these patients, the first thing I'm doing is ruling out any other issues that might be causing the lymphedema, like we talked about, blood clot, infection, heart or kidney issues, and then trying to treat it with the help of a certified lymphedema therapist as well. And that includes prescribing equipment. Sometimes, that means sending a script for the garments that patients might wear to help decrease the swelling, or the pumps like we talked about. That also means prescribing the rehabilitation, so occupational or physical therapy that the patient might need to get back the range of motion in that extremity due to the swelling, and also providing education on what signs and symptoms to look for that might be the swellings coming back due to the lymphedema, or it might be another issue that's causing the swelling that patients need to be aware of and alert a medical provider about. Joint pain, unfortunately, is a very common thing among cancer survivors, whether that's due to many cancer survivors being older in age, or due to the treatment, is something that we kind of help tease out for patients and their providers. There are some specific causes that are related to cancer, its treatment, that we often see. So aromatase inhibitors are a type of medication that are given to people with breast cancer, and they can cause a syndrome where people develop joint pain in multiple joints after the starting of these medications. And so that involves, identifying that as the cause and communicating with the medical oncologist about, different perhaps treatment options for that patient. Unfortunately, when patients develop weakness or numbness in one extremity or swelling in one extremity, they may, on their other side, develop overuse syndromes, because now they're going to be favoring that side because they don't feel like they can use the other side as much because of the swelling, numbness, weakness on that side. So we get overuse syndromes for that. Resources that we direct patients to often involve physical or occupational therapists. Sometimes it requires the referral to a pain medicine physician, depending on what the pain is like, and if there's medications that may be needed to be used that a pain physician is best suited to prescribe. But from a cancer rehabilitation physician perspective, we often try oral or topical medications. So medications like lidocaine cream. Sometimes we use a lidocaine patch, depending on where the area is. Voltaren gel can sometimes be very helpful. These are all over-the-counter medications, but I would, of course, recommend consulting with a provider before using them just yourself. Sometimes we find if the joint pain is localized to one joint, we could provide an ultrasound-guided injection of steroid to that area to try to help with the pain as well too. Helping also devise an individualized rehabilitation or exercise program is something we do, and then considering patients for bracing if they have particular pains or joints that are unstable due to the pain is within our wheelhouse. Nerve pain, we kind of alluded to nerve pain before when we were talking about chemotherapy-induced neuropathy. But there can be many causes, either related to the cancer itself, depending on the location or its involvement of the nervous system, from the brain to the spinal cord to the nerves that go out into your hands and your feet. It can also be due to the treatment. Chemotherapies, there's a number of chemotherapies related that can cause nerve damage or nerve injury, radiation, and of course surgery, where they may cut nerves during the surgery, can cause nerve pain. Physical and occupational therapists can be helpful because they can also help with making sure that you have the right equipment needed to help in your day-to-day life. Pain medicine physician in the same vein can be helpful depending on what interventions or medications that might be needed. But in my clinic, when I see patients with nerve pain, I do a full assessment to kind of understand the underlying cause of the nerve pain. And then we consider different oral topical medications. Some medications you may have heard of before for nerve pain are gabapentin, also known as Neurontin, um, duloxetine, also known as Cymbalta, or pregabalin, also known as Lyrica. Again, these are medications that require a prescription, and I wouldn't recommend unless you see a physician and have been evaluated for. Some people also benefit from topical medications. The one that's been most proven to help with nerve pain is capsaicin, and that's actually something that comes from a chili pepper. So it's just a very hot sensation, which sometimes people that have terrible nerve pain find relieving to them. It also may involve, like I said, interventions by a pain medicine physician. Sometimes nerve stimulators can be placed, or nerve blocks can be done to help with the nerve pain as well. One area that I really want to talk about, because I saw a lot of breast cancer survivors would be attending, and I think this is something that should be on the radar of any breast cancer survivor, is a condition known as post-breast surgery shoulder dysfunction, restriction, or pain. In the past, it's been known as post-mastectomy pain syndrome. And honestly, I've seen people that have developed this similar syndrome even after just chemotherapy or radiation, not necessarily mastectomy or lumpectomy. And of course, while the surgery is done, it can lead to issues with shoulder range of motion, pain, muscle weakness in that area. And so, what we want to do is recognize this early. This usually happens about 3 months or so after treatment, but can happen kind of anytime after that. I've seen patients even years after their treatment develop this condition. It involves getting physical or occupational therapy involved, really to work on that range of motion, kind of help decrease pain as much as we can. And then from a cancer rehabilitation physician's perspective, I talk to these patients about, what is the actual cause of their pain? Is it due to a muscle or joint issue, or is it more due to a nerve issue? And as we talked about before, there are different options for that. Are there injections that might be helpful, using ultrasound to kind of guide us and make sure we're putting the medication in the right place? Again, this is all individualized to the patient. There's unfortunately no injection I can just say this is the injection to do if you have this condition. It really depends on where your pain is and what's the character of your pain. And so that's why it's really important to get into a physician who treats these conditions to make sure you're getting the best evaluation. Radiation fibrosis syndrome is a condition that affects most people, or it can affect anyone after they've received radiation, but it can also be delayed from the radiation. So what I mean by that, it can happen soon after, within weeks to months. I've even seen it kind of years after radiation treatment. Most of the people I see with this in my clinic, just because I'm associated with the big head and neck practice within my system, have had head and neck cancers. And this is due to fibrosing the muscles in the field of radiation. And it can lead to pain, limited range of motion, and unfortunately difficulty with speaking or swallowing. And so with these patients, like to get them into some kind of structured rehabilitation program with either physical, occupational, and or speech therapy. And then from my perspective, again, it's about diagnosing and treating the underlying cause of the pain. Is this due to an issue with the nerves? Is this due to an issue with the joints, the muscles that are involved in the area of radiation? And then determining if there's any ultrasound guided injections, nerve blocks that can be done to kind of help patients with this condition. There's a lot more options than people I think are aware of, but it just takes a specialized professional who kind of knows what options are available to give the different treatment options to the patient. Honestly, there are a lot of reasons to have generalized cancer-related pain, unfortunately. cancer is a terrible disease, and so I see many people that come in not having pain in one area of their body or another, what not necessarily related to an area because it's been treated or not. So, unfortunately, what we try to do for these patients is get them into therapy, whether that's an exercise program or physical or occupational therapy, and then of course evaluating our options like we did for the other pain syndromes. What do we think is the main generator of this pain? What medications are best suited for that? Are there any injections or interventions that we can do for them to help alleviate their pain? The biggest thing in treating pain, from my perspective, is trying to get to a point where people can try to achieve their goals in lives and improve their quality of life. Unfortunately, sometimes people have difficulty eating after cancer or its treatment, and this can be for a variety of reasons. People can have difficulty with swallowing, whether that's due to the cancer or its treatment, difficulty opening, including their jaws. We know that cancer or chemotherapy can change our taste and make us have poor appetites. And so, what we try to do is get hooked in with a dietitian who can evaluate kind of what's a patient's nutritional needs and what are things that we can offer to help meet the nutritional needs, whether that's supplements. So, I'm a big proponent of different protein shakes. If people, cancer survivors, probably hear this from their oncologists, but it's important to have a certain amount of protein intake and meet that because that's been shown to help prevent things like cachexia, which we talked about before, that muscle wasting disease, which can help decrease recurrence of cancer, help with long-term survival from cancer. So I really am indebted to the dietitians I work with. They work very closely with our team and helping patients make sure they're meeting their nutritional needs. Seeing a speech therapist is also important to kind of get a swallow evaluation, understand what difficulties a patient might have with swallowing, see if there's exercises that can help, or determine if there are other treatments that are possible for the patient to improve their swallowing. Obviously, the role of the cancer rehabilitation physician is to refer patients to these two different professionals and also help come up with an individualized rehabilitation program with them involving exercise programs as well. And sometimes a palliative medicine provider can be helpful in these cases to help determine kind of what a patient's goals are with eating. I've had patients who unfortunately, have had to require a tube to help them eat, but yet we've gotten to a point where they can eat a certain amount of things that they really enjoy orally through their mouth because that's improving their quality of life. It's not meeting their nutritional needs, but because quality of life is so important when patients are undergoing cancer treatment, we make exceptions. But of course, that's through collaboration with all these different professionals to come to that decision. Difficulty with speaking is common as well too after cancer, depending on where it's the cancer involvement, especially if it's involving of the brain, whether that's a metastasis to the brain or the cancer spread to the brain, or if the cancer originates in the brain. It can also be difficult for patients to understand or read or write due to where the tumor might be. And so it might also be due to surgery. So sometimes patients have the tumor removed either from the head, neck, or brain, but yet they still have these issues with speaking. And so referral to speech therapist would be the next step for evaluation of the speaking difficulties, understanding exactly what the difficulties are and providing exercises and rehabilitation towards improving that. Also talking about alternative communication strategies for these difficulties with speaking, like using communication board, or if it's a head and neck patient, sometimes they need to use a device called electrolarynx to help them produce sound so that they can speak. From a cancer rehabilitation physician standpoint, it's all about helping patients navigate kind of what therapists would be best suited to treat them, and then helping to prescribe and order these devices that are appropriate for patients. Cognitive deficits or chemobrain, very common. 3 out of 4 cancer survivors often develop this, whether that's soon after their diagnosis or even after their treatment. What it involves is impairments to things like an executive function. So that's how we manage our time, how we organize ourselves, how we problem solve. Working memory, which is remembering things we need to know off the top of our head, like our wife or husband's phone number, names, what we ate for breakfast. And then there's issues perhaps with processing speed. So how we transition from one task to the next, or how we react to hazards, especially when driving. So, what are some resources that are available? Well, A Time to Heal, hopefully you know, has a great class on this that I've had some patients do called Navigating Brain Fog. It's not just for cancer survivors, but also for caregivers as well too. And I think it's a great resource that's available for patients or caregivers of patients with cognitive deficits or chemo brain. A speech therapist can also be helpful in kind of evaluating and identifying these issues and areas in particular to work on through cognitive exercises. And I think another thing that patients often ask about is with the chemo brain, about driving. And there are, at least in our area in Omaha, Nebraska, quite a few drivers rehabilitation programs that a cancer rehabilitation physician like myself can get patients plugged into to help kind of get them back to driving, hopefully safely, with these impairments that they might have. Mood changes is another thing oftentimes cancer survivors report having, and this can happen anytime during cancer survivorship. Of course, it affects the quality of life and can also affect a patient's desire or tolerance of treatment. And so it also affects a lot of these other things that we talked about: appetite, sleep, concentration, energy levels. And so it's very common. I want people to feel like it's okay to have these feelings, because this is I want to normalize this for cancer survivors, because oftentimes I think people are afraid to share these feelings, but it's very important to share if you're having these feelings with anyone within your cancer rehabilitation team or in your cancer team at large, because there are things that can be done to help you. You're not alone going through cancer or its treatment, and so we want to make sure you have the resources available. Oftentimes, patients really benefit from speaking with a licensed mental health practitioner, and there's several in our area that are very good and work a lot with cancer survivors. Also, sometimes talking with a psychiatrist can be helpful, and I share this with cancer survivors all the time, that sometimes medication can be beneficial. I'm a person where I don't like just prescribing medications unless I know that there is research that shows it's beneficial, and that I know and educate the patient on different side effects that can be possible. But I feel like for this issue, it can be very beneficial to prescribe even just a short term medication to help with some of these mood changes, especially in the first few phases when people are initially diagnosed with cancer or starting its cancer treatment. There are a lot of feelings that are going on at that time. And the support groups, I think, are really important to get plugged into. And that's why any patient that comes to my clinic gets a brochure about A Time to Heal and its resources and multiple support groups. There are specific support groups to different types of cancer, which can sometimes be helpful, and meeting people that have the same cancer. So there's a few listed here in particular. There's also exercise programs that have been shown to be beneficial for people with, you know, low feelings or mood changes after cancer diagnosis. And then trying to get patients back into work, I think, is also oftentimes helpful in navigating this process of mood changes after cancer diagnosis or treatment. I feel like a lot of people just want to, sometimes people react, they just want to get back to what they were doing before they were diagnosed in treatment. And so we try to do that as a cancer rehabilitation physician. One topic that I'd like to talk about, which I feel like is a faux pas, unfortunately, but I think is very important for cancer survivors, is sexual dysfunction after cancer diagnosis or its treatment. You can see that it can affect studies have shown anywhere from 40 to 100% of cancer survivors, of course, depending on where that cancer is, what it's involved, or the treatment that the patient has received. Um, Commonly affects patients or with treatments affecting the abdomen, pelvis, especially the prostate or breast cancer. And this can include issues with erection or ejaculation, low or loss of libido, that's desire, vaginal dryness, or even painful intercourse. We also know with cancer diagnosis and treatment, there's a lot of psychosocial factors that come into play. There's body changes, there's altered body images, there's mood changes, and these can all compound or add on to the physical dysfunction that might come for the disease or its treatment. So, what resources are there? It depends on what the sexual dysfunction is, and of course, you need to see a provider can identify what areas can need to be addressed. But for those that might have pain with intercourse or pelvic floor issues, seeing a certified pelvic floor therapist can be very helpful in that area. Um, Also, a lot of research has gone into seeing a psychologist for sex therapy, which is therapy that talks about intimacy with your partner. A lot of research, even put out by the American Society of Cancer Clinical Oncologists, has espoused how important and helpful that this can be for patients that have sexual dysfunction. Seeing a urologist or a gynecologist, depending on what type of dysfunction, whether if it's erectile or ejaculatory dysfunction or vaginal dryness, can be addressed by these different providers. And the cancer rehabilitation physician can kind of help um, navigate patients through this process and get them to the right provider that can help them. Gastrointestinal or urinary issues, again, I talked about before, can be common too. This can include bowel or bladder incontinence, constipation, trouble with urinating, and this can all be related to where the cancer is or what treatment somebody has received or is receiving. I most commonly see these issues with cancers affecting the colon, the rectum, the prostate, or the uterus. Physical therapists, some are certified pelvic floor therapists or incontinence therapists. Again, it just can direct patients to those if needed. And then sometimes a dietitian can be helpful in adjusting kind of diets and supplements to help with these issues. Sometimes it also involves a referral to a urologist, whether that's for further testing to identify why there's issues with incontinence or specializing in sometimes different interventions or treatments for issues with the urinary symptoms. Sometimes I refer also to a gastroenterologist, kind of similar issues if there's issues with bowels. I think from my perspective, oftentimes it involves directing patients to a certified therapist that can treat their issue or a referral to a specialist like a urologist or a gastroenterologist to determine, if there's something they can do as well, but also determining like what's the actual cause of the issues. Is it related to their cancer or treatment, or if it's some other issue? I wanted to add a few slides because I received some questions ahead of time. So thank you. These were your questions about hair loss. And so, I'll talk a little bit about that here, and of course can answer some questions if I'm able to at the end. But unfortunately, hair loss is pretty common, especially in patients who are undergoing treatment for breast cancer. This can be due to either chemotherapy or radiation. And so, and it can start pretty soon after receiving one of these or starting these treatments. Uh, the treatment for this kind of starts preventative measures. You might have heard of some scalp cooling devices that have shown some promise in helping keep hair. There's actually one of my good friends, and she's fine with me sharing this. Through residency, actually was diagnosed with stage 2 breast cancer, like our first year of residency, and so I remember her going through this process of, doing the scalp cooling and everything to try to prevent hair loss while she was undergoing treatment and starting residency. She's doing well now and is graduating this year, so I'm very happy for her. Some patients I talk with, will use hair camouflage products is kind of what I like to group them as. So wigs, hair pieces, head coverings. Some people may even consider hair tattoos of like their eyebrows. I've seen before. There are some hair restoration options, so medications, um, Medoxanil off the top of my head is one that some patients are on, or surgery options. To be honest, I'm not a person that treats hair loss. I usually refer patients to a dermatologist to consider any medications or surgeries for that. But there is a great resource that I found in preparing for this presentation from Memorial Sloan Kettering Cancer Center, which is in New York, considered probably one of the best cancer centers in the world. And they have a great patient education page on hair loss and kind of resources for that. So I direct you to there to find out more. In summary, as we talked about, the number of cancer survivors is growing. And so with that, the number of cancer survivors with functional impairments is also growing. And cancer rehabilitation is a small growing field that is really designed to meet the needs of cancer survivors and their caregivers for these common issues that we talked about today. And so we are really uniquely suited to treat and support cancer survivors. And it's really been a blessing for me to be able to treat this population. I have had many patients or many family members who have had colon cancer and breast cancer. And so it's a personal crusade as well for me, and a pleasure really to treat cancer survivors. So with that, I want to thank Jeannie and the whole Time to Heal crew for asking me to give this presentation, allow me to talk with you about it this morning. I want to thank Methodist Health System, where I'm employed. I'd like to thank my mentor, Dr. Ishan Roy, one of my colleagues, Madonna Klein. Of course, I want to thank my patients who are, mean the world to me, and my wife and my son who also mean the world to me. And I also want to say happy Valentine's Day to everyone as well, too, if I haven't already. So with that, hopefully we have some time for questions. I'll do my best, as I said to Jeannie, to answer them to the best of my ability. I will be honest if I can't answer a question. I think that's always best to be honest and say, rather than just rattle off advice that may or may not be the best. So with that, I'll turn it back over to Jeannie.
Great. Thank you so much for sharing all of your expertise. Your patients are so lucky to have you. And we do have some questions that came through on the chat.
Great.
And I know we're getting close to time here, so if people have to hop off, we understand that. Thank you for spending your Saturday with us. Okay, can you list some examples of medications for fatigue?
Sure. So I just looked this up. So there's a couple different medications. I should say I looked at the most recent literature. So there was a meta-analysis that came out in the Journal of Clinical Oncology last year by Dr. Stone. And they looked at methylphenidate, which is Ritalin, for the use of cancer-related fatigue in patients with advanced cancer. Fortunately, that study didn't show that there was a real difference of giving that medication with patients that took not that medication. But I think in the right patient, it could be helpful. So sometimes that has been prescribed just short term to see if that's helpful or not. Obviously, that medication comes with side effects. So that's something we counsel our patients on to make sure that's something that they potentially would be okay with if that should be a side effect. There's also been some research using steroids short term to help with cancer related fatigue. Unfortunately, those studies didn't show a significant benefit, but again, it doesn't mean clinically. I don't see that used sometimes in patients or use that myself. There's also a medication called Provigil that can sometimes be used. I see it more used in brain injury patients to help kind of with energy. Again, that has side effects that would want to go over with the patient before prescribing it. And unfortunately, the studies that have come out that have looked at it for cancer-related fatigue have not shown a significant benefit. But again, it's a clinical decision individualized to each patient. So when I say a study doesn't show a significant benefit, it just means statistically it doesn't show a significant benefit. It doesn't mean individually or anecdotally there aren't stories of patients having benefit from these medications. But for that to be said, I wouldn't just go out and start these medications. It really requires you meeting with a physician and talking with them about these medications before starting them.
Great. Thank you. There
Mm-hmm.
was a comment that someone said they used their rebounder to help with fatigue. And then also that it may they've heard that it'll help with like the lymphatic system. Do you ever recommend like a rebounder for that?
Um, it depends on the patient. Uh, it really depends. I would say I'm neutral for that, to be honest. I'm all about, again, and that's why it's hard to give generalized advice, because I feel like cancer and its treatment is becoming so individualized. So cancer rehabilitation is becoming more and more individualized. I would say, if that's working for you and you find that that's helping with multiple, problems that you're having, that's great. I'm always looking for solutions that help in multiple ways, because I think that's easier for people to do and has fewer, bad side effects or anything like that. So I would say I don't have anything against it. I don't have anything for it. If it's helping you, that's great.
Great, thank you. And then there was a question, are you familiar with using healing touch to help with neuropathy?
Yes, I am familiar with using Healing Touch. There's a service at my hospital that's even called that. And so we do use that for patients with neuropathy. I think there is a lot of benefit of manual therapy, as that's called sometimes, to help with neuropathy as well too. And I'm all about using multiple modalities to help with pain. So not just using a pill or a patch, but using multiple ways to treat pain.
Great, thank you. And then do you happen to know of any support groups for leukemia in the Des Moines, Iowa area?
Ooh, I don't know if they're in the Des Moines. I think I had a slide about there's a leukemia and lymphoma
Oh,
society. They
okay.
usually have pretty good coverage across the country. I would look at their website to see if there's something in the Des Moines area. I don't know off the top of my head, to be honest, but um, I think that it's a national society, and I would hope in some of the larger cities they would have one. But you know what? If there's not one, that's maybe an opportunity to found one.
Great idea, great resource. Can you provide a copy of the resource list slash brochure that you provide to your patients?
Yeah, so one of the main resources I give is a time to heal. I think I also have a resource summary
Oh,
here on this page, which hopefully the slides will be shared.
okay. Yep. I
Um,
see that.
but here's some further resources about some of the resources I give. And then, I give out the time to heal brochure. So hopefully you're aware of a time to heal. And you can find a lot of the resources that I also give to patients on their website.
Great. Let's see. And do you know of any national or local vocational therapy slash rehab sources?
So vocational therapy locally in Nebraska is Nebraska Vocational Rehabilitation. They have a website there. They may need a prescription from a provider to see a cancer survivor.
And this person's
But
in Iowa, by the way. Sorry.
in Iowa. Oh, okay. Sorry, I was gonna say I heard local, so I thought
Yeah, I said I omitted the Iowa. Sorry.
that's okay. Iowa should have similar resources to Nebraska. It's state dependent, unfortunately. So Iowa should also have a vocational rehabilitation department or center that can provide resources.
Great. Well, we had awesome questions. Is there
Yes.
any last one that would like to ask a question? We're a little bit, couple minutes over, but if there was any burning questions. No. Okay, well, I want to thank everyone. I'm going to stop the recording, but if you can hang on for 1 second, I just have a couple announcements of some of our upcoming. Well, actually, I will announce our next Create Your Best Life will be March 14th, and that will be Food for Life After Cancer. And then our upcoming classes are we have our Navigating Brain Fog class. Our next one starts February 24th. We have our Survivorship 101 class. The next class starts March 10th, and these are all virtually. And then we have a Survivorship 101 for survivors under 45 that starts March 18th. So, as always, for any of our classes, you can check out our website at atth.org. But again, thank you, Dr. Villanueva, for your time and expertise. It was awesome and all of your resources. And thank you all for spending Saturday with us and your Valentine's morning. So I hope that you all have a wonderful weekend.
Yes, happy Valentine's Day, everyone.